Hey everybody, it's Dr. Mike. I'm trying a second installment of the video blog. This time I wanted to get to some more specific questions about medications. In this case, I had a question about what we might use to treat a 5-year-old with the typical anxiety and hyperactivity that you see in a Fragile X child at that age. It's always a difficult question when we're trying to treat a very young child because there are certain medications that we feel more comfortable with in younger kids, and then there are other medications that we don't necessarily feel quite as comfortable with. As you probably already know, the most common medication for young kids in the U.S. anyway is Ritalin and other related stimulant medications. That might be helpful with the hyperactivity that you see in a 5-year-old, but it would probably make the anxiety a bit worse, and so we tend to look to other classes of medications. Now, for treating anxiety in Fragile X, a lot of times the SSRI type antidepressants, the selective serotonin reuptake inhibitors, can be helpful, but in young children, often activation is a big problem. So you give the child a medication to try to help with the anxiety, but then you end up making the hyperactivity worse. So a lot of times that doesn't work out too well either. That's when we tend to turn to another class of medications, which is often used in young kids generally, called sympatholytic treatments. And these are drugs that decrease the activity of the sympathetic nervous system. And the idea is to try to decrease the amount of activity in the autonomic nervous system, that kind of fight or flight response that people have, and folks with Fragile X seem to have a little bit too much of. So the most popular drugs in this class are clonidine and 10X, or guanfacine. Nobody ever mentions clonidine by its name brand because it's been generic for so long, but it's actually known as Catapress. In fact, there's a clonidine patch which is known as Catapress TTS for transdermal therapeutic system, and that can be very useful. I'll talk about that in just a little bit. I also get some questions about beta blockers. Since so many adults take beta blockers for high blood pressure, I'm often asked if that's something that's useful for kids with Fragile X. I have seen a few kids successfully treated with beta blockers, usually older teenagers that have problems with hyperarousal. Younger kids who take beta blockers can get a useful response, but that usually requires a much higher dose than pediatricians are willing to prescribe. So I've seen a lot of younger children prescribed low doses of beta blockers that frankly have no therapeutic effect. So they're just very subtherapeutic doses of beta blockers. So my general take on beta blockers in Fragile X is they can be useful, but they're typically only effective at rather high doses, much higher than you would usually give for hypertension. And those are unlikely to be used because most pediatricians are going to be concerned about prescribing doses that high because of the potential side effects. However, with clonidine and guanfacine, we can usually prescribe a dose that's quite effective. And in fact, in kids with Fragile X, we usually see kind of an extreme sensitivity to the effects and the side effects of the drugs. So we're often starting out at very, very low doses for either of these drugs. That ends up being a bit of a problem in the case of clonidine because the pills are so small. Literally, the pills are just tiny, and so it's hard to subdivide them any further. They're usually scored so you can break them in half, but the smallest clonidine tablet is only 1/10 of a milligram. And a lot of times, kids with Fragile X will have a hard time even tolerating 1/4 of one of these pills. So then we get into this sort of ridiculous situation of trying to break them up into eighths. And the sizes come out very uneven when you try to divide a tiny little pill into even tinier subsections. So for that reason, I recommend a lot of people even start with the clonidine patch. It comes in 3 sizes. It delivers 0.1, 0.2, or 0.3 milligrams over the course of 24 hours. And for hypertension, the patches are designed to be left on for 7 days. So they will dispense the medication continuously over the course of 7 days at a controlled rate. It does actually vary a little bit, and since people with Fragile X are so sensitive to this, we often can see the ups and downs that come as the patch gets older. So it often only lasts 3 or 4 or 5 days rather than the full 7. But one nice thing about the patch is that you can cut it to adjust the dose, and it doesn't actually damage the patch. It works just fine. It doesn't destroy the integrity of the patch, and it still seems to deliver the dose of the medication pretty well. So you can tailor the dose quite precisely by nipping corners off the patch and just reducing the surface area. The dose that gets delivered is proportional to the surface area of the patch. That gets a little bit hard to keep it stuck on sweaty little kids in the summertime, especially if they're in the swimming pool every day. So you may need to account for your particular lifestyle. It might not work if you have a younger child who likes to swim a lot. You also have to be careful that people don't peel the patch off and chew on it, because the patch actually has a 25-day supply of the drug. It's only designed to be on for 7 days, but they have to have more of the drug in there total just to keep the gradient up. So there's a lot of drug in there, and you can potentially overdose on clonidine by chewing on the patch. So you have to be careful with kids and make sure that they don't take it off. We usually apply it between the shoulder blades. It makes it a little bit harder for them to get at it. Most people find that it's pretty comfortable to wear. Guanfacine, or 10X, is another option. It's a related medication, which is a little bit longer acting, but it's a little bit less potent. That means the pills are a little bit bigger and they're easier to subdivide. So it's a little bit easier to get the right oral dose, and since it's longer acting, if you give it 2 or 3 times a day, you get a relatively steady effect. So you don't see the kinds of ups and downs that you'll sometimes see during the course of the day with clonidine. Back when guanfacine was only available as name brand 10X, there were all sorts of academic psychiatrists who were claiming that 10X had some mechanistic advantages over clonidine, that it was a better drug, that it did things that clonidine didn't do. For some strange reason, since guanfacine has gone generic, nobody seems to be claiming that anymore, and I personally consider them to be entirely equivalent. It's just that guanfacine is a little bit easier to use as an oral formulation, and the clonidine patch is a little bit easier to use overall, especially if you have somebody who's not used to taking pills. Both of these medications will dampen down that kind of autonomic overdrive that a lot of kids with Fragile X have. However, there's a very high rate of sedation and irritability that comes from taking these medications. So a lot of kids will wash out during the first week. They just can't take it. It just makes them too grumpy, and they have to stop taking the medication. Overall, it can decrease hyperactivity quite nicely. It can help a lot with sleep. I think you need to be careful about rebound. In other words, when the drug is not in your system, then essentially you can get symptoms that are the exact opposite of the initial side effects. You can get an increase in hyperactivity. And so I don't usually recommend that you give these medications just at bedtime, because what happens is it'll get the kids to sleep all right, but then the whole next day they'll be rebounding and more hyperactive than ever. So it's good to give multiple daily doses and to try to make a commitment to it and to stick with it for a little bit. It can help a lot with the anxiety that comes from hyperarousal, but it's not an anti-anxiety drug in and of itself, so you can't expect too much. It makes a great combination with the SSRIs, and the two tend to offset each other's side effects. So that's it for the sympatholytic treatments for now, and I hope to maybe tackle some other issues in future video blogs. Bye-bye.